Good morning. Over the last week, COVID-19 cases have been stabilizing across much of the United States. In Iowa, new cases continue to decline and are now at levels we haven't seen since late August. A downward trend continues in the number of Iowans hospitalized with COVID-19. Statewide, they fell to 382 just a few days ago and stand at 408 now. That's 1,100 fewer people hospitalized now than in mid-November when we reached an all-time high of more than 1,500. Daily hospitalization admissions also continues to decrease, which could be attributed in part to more physicians and patients opting for the monoclonal antibody treatment following a COVID-19 diagnosis. Additionally, our long-term care facility outbreaks are down to 61, and new cases among residents and staff continue to decline. Iowa is making steady and positive progress in our COVID-19 response and recovery. But some skeptics suggest that maybe this is due to a decrease in testing, assuming that cases are dropping only because fewer Iowans are now choosing to be tested. However, our testing level now is consistent with that from October and early November, which was an all-time high at that point, until demand for testing rapidly rose to record levels during the height of the surge. So it's not surprising that it would return to a more stable level now, or that levels could fluctuate a little bit from week to week. But it's certainly not an indicator that the progress we're making is somehow less than what it seems. I believe we can attribute our progress to one thing, and that's Iowans. For months now, and especially since November, we experienced the very worst of the pandemic in our state. Iowans realized the seriousness of the situation and the importance of being a part of the solution to overcome it and sustain it. It isn't any one thing that we've done. It's all the different ways we've adjusted our behavior to keep the virus at a manageable level so that we can continue to live our lives as normally as possible. We've proven we can do it as long as everyone continues to exercise personal responsibility, and the progress you've made possible will continue as well. Yesterday, I had the opportunity to join governors from across the nation for what will be a weekly conference call with members of the Biden administration regarding the state of the pandemic and the plan to accelerate vaccination. Updates were given by Dr. Walensky, the new CDC director, General Panerna with the Department of Defense, and members of the White House COVID-19 response team. We did receive some positive news that the federal government will be increasing each state's vaccine allocation by 16% starting with next week's shipment. In Iowa, this should equate to an additional 6,300 doses, and they did say that that increased amount is guaranteed for the next 3 weeks. We were also informed that the new Johnson & Johnson vaccine is expected to receive emergency use authorization from the FDA next month. And this is a single-dose vaccine, and it will greatly simplify and speed up the vaccination process nationwide. Even with the positive news, and that is, I just still want to remind Iowans that the vaccine supply will still remain limited for quite some time. But despite that challenge, we are making good progress in our efforts to vaccinate as many Iowans as possible. Last week, when I announced the updates to Phase 1B, including the expansion of vaccine eligibility for adults age 65 and older, many counties that had already completed 1A vaccinations and had doses available had immediately moved into that next phase. So I want to thank those local public health departments and the vaccine providers for moving ahead. Even with the 16% increase starting next week, the nation's current vaccine supply simply cannot keep up with the incredibly high demand. And I know that that can be frustrating to hear. I know Iowans are very eager to get vaccinated and finally put COVID-19 behind them, and that time is coming, but we need to remain patient. It's really hard to believe that just 46 days ago, not a single dose of vaccine had even arrived in Iowa yet, just 46 days ago. But since then, more than 200,000 vaccines have been administered in Iowa. And really, when you even put it into further context, that's just 9 months since Iowa first reported its first cases. It reminds me of a time not too long ago when we had to limit COVID-19 testing to a very small population of people because there weren't enough tests available nationwide. Then the supply chain began catching up to the demand, and we were able to get supplies through a public-private partnership and stand up the Test Iowa program less than 2 months after the first positive cases were identified in our state. So I think we'll continue to see that type of progress with the vaccination. And even since then, the number of testing providers has increased exponentially. Today, there are countless ways to be tested, including an over-the-counter test kit that you can complete yourself at home. Vaccines will follow a similar path as soon as manufacturing ramps up. More vaccines are approved and rolled out, and our state allocation increases even more so that we can get more supply to more providers statewide and into the arms of Iowans. One of the most highly anticipated vaccine milestones will be when every long-term care facility in the state has been vaccinated. Earlier this week, I spoke with leaders from CVS and Walgreens, the pharmacy partners that were hired by the federal government to manage the long-term program in Iowa and in states all across the country. Despite a slow start, they've assured me that the vaccine clinics are going well and remain on schedule. The first dose of vaccine has now been administered in nearly every long-term care facility in Iowa, and this first phase of vaccination for residents and staff will conclude at the end of this week. The second phase has already begun in some of the facilities, providing booster doses to those already vaccinated, as well as first doses for those who weren't vaccinated in the first round, and that phase is expected to end in late February. And then a third and final phase will ensure everyone vaccinated receives that second dose that got the first dose in the second round. Overall, the program is reporting that they've seen a 90% uptake of long-term care residents in Iowa. They're choosing to be vaccinated, which I think is extremely positive. The rate has been a little bit lower among staff during the first phase. That averages about 50%. However, when I talked to the pharmacy partners this week, they are seeing about a 30% increase in staff choosing to be vaccinated during the second phase, so we're seeing an uptick in that. The lower than expected uptake among staff has resulted in a growing unused supply of vaccine at both CVS and Walgreens. Since the federal government allocates vaccine for the program directly to the pharmacy partners, we're unable to reclaim it for use at the state level. However, in visiting with them and upon my request, both pharmacies have agreed to return the unused vaccine so it can be reallocated for state use. We're working on the logistics of that now with the CDC, and as soon as we receive the unused vaccine, it will immediately be distributed to providers to vaccine adults age 65 and up. You know, Iowans are asking many questions about the vaccination process, but nothing is more important to them than knowing when enough vaccine will be available and how they'll be able to get it. While the issues of how quickly vaccination can move ahead, it's because it is dependent upon supply. The good news is that there's no shortage of providers ready to administer it. In fact, pharmacists across the state, including those in rural communities, have been part of the vaccine planning process for months. The Community Pharmacy Enhanced Service Network, or CPESN Iowa, is a network of nearly 120 community pharmacies across the state. And their patient-centered approach, relationships with local healthcare providers, and strong ties to their communities make them an ideal partner to help advance vaccination efforts in every corner of our state. Today, I'm pleased to have with me Lindsay Ludwig,